This is Dr. David Albert from the Digital Health Summit here at CES 2019. And it is truly an honor for me to interview Dr. Ann Curtis, Chairman of Internal Medicine at the University of Buffalo and a noted cardiac electrophysiologist, and I'm happy to say a friend of mine. So, Ann, welcome to the Wild Consumer Electronics Show.
Thank you.
I just heard you talk about digital data, wearable data. Thank you, AliveCor. Viewers may know I'm the founder of AliveCor. But what I'd like to hear from you is, what do you just think about this? You know, you've been at HRS, ACC, AHA. What do you think about this venue and this show?
This is absolutely incredible. I mean, as you said, I go to cardiology meetings all the time, and I thought they were large, and they're nothing compared to this. To be able to walk around the exhibit hall and just see the incredible number and variety of different electronic things from homes to security and safety to making our lives easier, and then digital health, how many different things there are in that space now too. It's been really fun. I've enjoyed seeing everything.
Well, thank you. You know, Dr. Marouche and I are like the only two people here wearing ties, so you know where we come from. Well, the second thing I'd like to ask you about is that if you walk around this hall, you'll see the Fitbits, the Garmins, the Withings, the Apple Watches, the Omron blood pressure watch, all of these wearable devices, and devices now recording ECG and allowing the transmission of that, something I'm pretty familiar with. Where is this going to fit going into the future with the care of cardiac patients?
Well, I think the Fitbit data and all we have about our activities, that there are simply ways of getting us healthier. And so whether or not you have heart disease, I think it's great for especially the American population with the amount of obesity we have and inactivity, for us to get better at that. In addition to that, though, I mean, exercise is important for cardiovascular health. And knowing that what blood pressures are, even management of diabetes, because so many people with diabetes have cardiovascular disease, and managing heart rhythms. It just gives us an ability to collect data, get more information, more robust information than we ever had the opportunity to have before. So I think this it handled the correct way, which means trying to manage this large inload of data and hone in on the important points. I think could really help us in managing patients to have better cardiovascular health.
Well, you've certainly been doing that and had a lot of experience with wearable data. I mean, cardiologists have used Holter monitors, wearable monitors, for 50 years. So we're not new. We're just adapting, I guess. I guess the last thing I'd say is, you know, people are, the Apple Watch has brought another level of rhythm monitoring to the general public and to probably a population that doesn't have a very high prevalence of cardiac rhythm issues. So are you concerned at all about the potential for consumer technology creating some issues of false positives?
Well, the good thing is that from what I've seen from these devices, both the AliveCor as well as the Apple Watch, is that we're not getting a lot of false positives. So that's the good news. I think we're always going to have the worried well, who are going to come in for a variety of reasons. But with these devices used well, what I hope is that we can actually show patients clean data and say that there really isn't a problem there. You know, for example, the whole issue of simply having your heart rate go up with you when you exercise. We want that. That's what's supposed to happen. And so as long as it looks normal, you know, I'm not really that concerned about it.
Well, thank you very much. Thank you for your great insights. And this is, again, Dr. David Albert at the Digital Summit of CES 2019. Dr. Ann Curtis, the University of Buffalo. Thank you, Ann.
You're welcome.